Hey, I'm Caitlin, and I am just going to be doing a respiratory assessment today. So I'm going to ask you a few questions, okay? Have you had any recent shortness of breath or wheezing?
No.
Okay, how about any chest pain?
No.
And any coughing with any bloody or purulent sputum?
No.
Okay, great. Do you have any prior respiratory issues?
No.
Have you had any surgeries or allergies?
No.
Okay. Have you had the flu pneumonia vaccine?
Not yet.
Okay, do you plan on getting it?
Yes.
Great. Have you had a tuberculosis testing done?
Yes.
And what were the results?
Negative.
Okay, and have you had chickenpox?
Yes.
Did you get the varicella zoster vaccine?
Yes.
Okay. Then have you traveled outside of the U.S. recently?
No.
Okay. Do you use any tobacco or recreational drugs?
No.
All right. How about any over-the-counter or prescription medications?
No.
Okay. Are you exposed to secondhand smoke or any environmental hazards?
No.
Okay. And then do you use any home oxygen or any nebulizers?
No.
All right. And then some family history. Do y'all have any family history of any respiratory infections, any asthma, any COPD, lung cancer?
No.
No? Okay, great. So I'm just going to get you to turn around so I can start by examining her posterior thorax. All right. I'm just going to set this to the side. So I'm just starting by looking at the general appearance of her skin. The skin is intact. The color variation is normal, and it is in range with the rest of her skin. I do see a few moles. I don't see any lesions or abrasions. I do see a few scars where maybe she's had some skin surgery or some moles removed. I'm also looking while she's breathing for any abnormal retractions, any deformities in her breathing pattern, or any impaired respiratory movements, which I don't see any of. Everything is even symmetrically and symmetrical bilaterally. So next I am going to palpate on your back. You're going to feel me touching on your back. If you feel any tenderness in any areas that I'm touching, you just let me know, okay? I'm also feeling for any lumps or any nodules. Do you feel any tenderness?
No.
Okay. Skin is warm and dry throughout, and she said there was no tenderness and I didn't feel any lumps or nodules. Next, I'm going to assess your lung expansion. You're going to feel me place my hands on your back, and I'm just going to get you to take a nice deep breath in for me, and then I'll let you know when you can blow that deep breath out, okay? All right, so go ahead. Good. Okay, great. So my thumbs moved away from your spine, and it was a smooth and even movement, which is what I wanted. Okay, so now I am going to assess for tactile fremitus. You're going to feel my hands moving down your back, and with that I'm going to get you to say the number 99 in a clear, firm voice. Each time you move my hands, each time you feel my hands move down your back. So you can go ahead.
99. 99. 99. 99.
Great. All right, so the vibrations were even throughout, and they decreased in the bases, which is normal and what I wanted. So next I'm going to percuss some areas on your back, okay? It just helps me to know if the area that I'm listening to or hear is solid, or if it is air or fluid filled. So you just stay like you are, and you're just going to hear me or feel me tapping on some place on your back, okay? Okay, so it was a hollow quality sound, which is a resonant sound. It was a long duration, a loud intensity, and a low pitch, and that is normal through your lung field, so that is good. And last, for respiratory, I am going to auscultate your lung fields, okay? So for this, if you would just make sure that you breathe in and out through your mouth, that way I can get the best to hear the best on your lungs. And if this sports bra wasn't here, I would, be listening directly to your skin. So just make sure you do a full breath in and out. Just don't hyperventilate while I'm doing this. I will listen as you breathe in and out, okay? All right. Okay, great. So I heard vesicular breath sounds throughout your back, which it's a soft and low pitch. I didn't hear any adventitious breath sounds, which would be any crackles, wheezings, rhonchi, which is normal. I am going to get you to turn around, and I'm going to listen to the top 2 lobes on the front and make sure that that matches up. Great, okay, so which is also vesicular, soft, low sounds, all right. So now I'm gonna go ahead and move to the cardiovascular and peripheral vascular system. So I'm just gonna start off by looking at the general anxiety of her face, or the general demeanor of her face. She doesn't have any anxiety that I'm noting. Skin is intact. The color is within the same normal limits as the rest of her body. I don't note any orbital edema, no cyanosis of the lips, which is good. I'm gonna move down to her neck, okay? I'm looking at the carotid pulse. I'm checking to see if I can see any pulsations from here, which I don't, which is also normal, and that's okay. I'm going to palpate just one side of the carotid pulse, so you're gonna feel me. Okay, I'm noting a 3+ strength, and I don't feel any thrills or variations. It's a consistent beat. All right, so now I'm going to listen to your carotid pulse with the bell of my stethoscope. I will ask you to just take a nice deep breath and then hold it for just a second while I listen, and I'll let you know when you can release that breath. All right, take a breath for me and hold it. Great. I don't hear any bruise, which is a good thing, okay? So while I'm in your neck region, I'm gonna go ahead and check your lymph nodes since I'm just in this area. So I'm gonna palpate the preauricular, your posterior auricular, occipital, tonsillar, anterior cervical, posterior cervical, you can relax, yep, submandibular, submental, supraclavicular, intraclavicular. All right, I'm going to look at the epitrochlear, right, or palpate for the epitrochlear right here, which I don't feel. All right, and then I'm going to do the central axillary and the lateral axillary. And I don't palpate any of those, which is normal. So now I'm gonna go ahead and move down and still looking at the neck, I'm gonna check for jugular venous pressure. If we were in a hospital and I had your head up to 45 degrees, I know that I would have your head at 45 degrees and ask you to turn your head to the right. And at that point is when I would check her jugular venous distension to see if there was any. So I'm gonna go ahead and move down to your precordium area, which is just the area over your heart. There's gonna be 5 places that I'm looking at today. It's gonna be the aortic, the pulmonic, Erb's point, tricuspid, and mitral areas. Okay, so I'm gonna be doing inspecting, palpating, and auscultating over all of those 5. Before anything, as I'm just looking, I'm noting the skin color, again, within normal variation and limits. I don't notice any abrasions or any lacerations of the area. I'm also looking for any pulsations, any thrills, heaves, or lifts, which I also do not note any of. So I'm gonna go ahead and I'm going to palpate over these areas right now. So aortic, pulmonic, Erb's point, tricuspid, and then up underneath I would feel for mitral. Okay, I don't feel any thrills or heaves or lifts there either. The skin temperature is warm, it is within normal limits, and I don't feel any variations in skin temperature. So I'm gonna go ahead and move to the auscultation, but before that, I would note that her PMI, which I was not able to palpate it, you would palpate the PMI, is less than, or is 1 to 2.5 centimeters, but I wasn't able to palpate that area. So I'm gonna go ahead and move to the auscultation part. I'm first going to listen with the diaphragm of my scope, and then I'm going to turn around and listen with the bell. All right, so aortic, pulmonic, Erb's point, tricuspid, and then it would be mitral underneath, which is also PMI. And then I would turn around and also do it with my bell. So aortic, pulmonic, Erb's point, tricuspid, and then up underneath would be mitral. Okay. And so now I'm going to move to more of the peripheral vascular section, where I am going to first start by looking at the your arm. I'm looking at her arms. I'm looking to make sure that they are symmetrical bilaterally in size. I don't see note any edema from just looking at them. The variation in the skin is the same, and so now I'm going to feel the temperature, comparing both of them, and it feels warm and dry throughout. And so now I'm going to check her radial pulses. I'm going to palpate those on both. You can, let's see. Okay, so it's a 3+ strength. There's no variations, and it is a consistent beat. All right, and now I'm going to check your capillary refill, and it is refills within less than 2 seconds. I'm going to now move down to her legs, and I'm looking to make sure that they are sized symmetrical bilaterally, making sure that there's no ulcerations towards the bottom of her legs, no brown pigmentation, which I do not see, and I don't see or note any edema. So now I'm going to also palpate her legs. I'm feeling the temperature of the skin. And then if you want to set your feet up right here, let's see, just so we can see. There you go, like that. Pedal, if you want to put the other one up here too. Pedal pulse, yeah, thank you. All right, so the pulse is consistent, no variations, 3+, and then capillary refill is less than 2 seconds.